Hey, it's Dr. Alicia here, and welcome to the She Found Motherhood podcast. Today we have Dr. Jasmina, one of our local perinatal psychiatrists, joining us today to talk about what it's like to be a NICU parent and what you can do to make it a little bit easier. Both Dr. Jasmina and I have had babies who needed a few days to weeks in the NICU, so we have a first-hand understanding of the challenges that can come with that. I had it with my second, and Jasmina had it with her first, which are both different stories. So check it out, and I hope that you find this useful if you have a baby in the NICU. Now, we do talk quite a bit about preterm delivery and why babies might need to be in the NICU in our online prenatal course. So if you're looking for a comprehensive online prenatal course that you can watch when and with whom you want, please check it out at our shefoundhealth.ca website under courses. Welcome to the She Found Motherhood podcast, where our goal is to support you in the journey from pregnancy through to parenthood. We are so passionate about this time in a woman's life, and we want to make sure you have fun and reliable information you can trust. She Found Motherhood podcast is meant for general medical information only. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. This does not apply to every situation. If you have questions or if you have received different advice, please contact your healthcare provider. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Dr. Jasmina, as you know, I had a baby in the NICU, and I'm pretty sure you did too. So I thought we could start off this podcast with a little bit of a story about why we're kind of experts in being a parent in the NICU. And I'll go first. So Evie, my second born, was born via emergency cesarean section at around 37 weeks. And she had a really tough time transitioning from life on the inside to life on the outside. She was breathing really quickly and her heart rate was rapid. And so the decision was made to take her to the neonatal intensive care unit, or NICU. She needed some extra support breathing and had an intravenous as well for fluids. And she also had a tube going down her nose and into her stomach so we could feed her through that. Now, over the next couple of days, she transitioned well and she didn't need any more support breathing. And eventually her feeding tube came out as we were starting to work on breastfeeding and bottle feeding. Then she got jaundiced and she needed some treatment for that as well. But what kept her in the NICU the longest is every time she would have heartburn, she had really bad heartburn, her heart rate would drop and her breathing would drop. They didn't have to do anything about it. She would get out, but they kept monitoring her. So we ended up being there for 21 days. So after all that, we got to go home. She was on some medication for her heartburn and a wedge to help her sleep more upright, which helped her reflux. Since then, she has been a fantastic sleeper and is currently a feisty, opinionated, active 6-year-old.
Thank you for sharing that story, Alicia. 21 days, it's a long time. Our story is a little bit different. So I was actually doing my perinatal mental health rotation in residency when I was pregnant in the late part of my pregnancy and just before I gave birth. So I knew about all of the different things that could happen and was preparing myself mentally for potential of being in the NICU, because that can happen to anyone. But then this was with my first child, Marco. I actually went post dates. So that is, I went into labor at 40 weeks plus 6 days. So I thought by this time, I'm most likely not going to be in the NICU. Well, it did not go as I thought. And I ended up also having an emergency C-section. And after Marco was born, he was quite wet, meaning that there was some fluid in his lungs. His blood sugar was quite low and he was very, very sleepy. So he had to go to the NICU. So I was very surprised at this point in time. And my husband too. I mean, this was our first child. So welcome to parenthood. And we remained in the NICU for 11 days, and Marco needed support with feeding. That was really difficult. He had to have a tube and go into his nose and to his belly so that he can eat. We needed support with breastfeeding, and in the end, it didn't work out as we had planned. I ended up pumping, but that it is what it is. And then he perked up, and his sugars became better, and he was more alert. And so we got to go home. And right now, Marco's actually 4.5 years old. Such a little active boy, very adventurous, very curious, very determined. And just yesterday, it was his first time out paddleboarding, and he did it on his own. So very proud.
Amazing. You know what? There's a lot of theories out there that kids who are in the NICU as babies are much tougher because of that experience. So I wonder if that's true. Both of ours seem to be a little bit feisty and adventurous.
Actually think that that's probably true. They've had a tough introduction into the world and were able to overcome it. And now, who knows what they will get up to.
Right?
Yeah.
But we certainly know that having a baby in the NICU can be so stressful. And like you've heard from both of us, not always expected. There are so many reasons your baby may be in the NICU, and this can be for a few hours to weeks, depending on the reasons. Some of the common reasons babies spend time in the NICU include being born early or preterm, having trouble transitioning from life on the inside to life on the outside, which is, I think, the case for both of our babies, or a known or unknown medical condition that needs extra support. So our NICU in Victoria is in the same hospital as the women deliver in Victoria and recover postpartum. Parents do not stay with their babies in the NICU, but can visit frequently and can spend most of the day or even night there if they choose, but they don't room in with the babies in the NICU. Other hospitals don't have a NICU as we do. So our NICU is able to support babies from about 24, 25 weeks on. So we are the highest level of intensity of NICU, but other communities don't have this. So a lot of smaller communities, if babies need to be given extra support after they're born in the NICU, they need to be actually transferred to a different hospital. Mom will also be transferred, and there's support for finding housing or a place to stay if you've been discharged from hospital, and that's where our NICU social workers are incredible. But certainly that can be added even more stress because you're not in your own home community. Make sure that if you do end up being in the NICU, that you reach out to the social workers who are there because they are so experienced in all of these different facets of life in the NICU.
Yeah, and I absolutely agree. Social workers are a wonderful wealth of knowledge and support. So I second that comment. But once you're in the NICU, and what's your baby? Sorry, I said you are in the NICU because it feels like the whole family is in the NICU. And your baby is really the only one in the NICU. It's a different world, and you need to learn the ins and outs of it, especially if your baby is going to be staying there for a while. So you will get a bit of an orientation to the NICU by your baby's nurse or social worker. If you don't, make sure that you ask for one, because it is really nice to understand the lay of the land and kind of how things are organized. You can learn about how often nurses change their shifts and how is the best way to talk to the nurses if you need to. You can learn about your baby's feeding schedule so that you can be present if you want to during that.
Great. So we're going to go over our top tips of what we learned as parents in the NICU so that you can just get right into it if you end up in the NICU and don't have to go through that big learning curve. So tip number 1, remember, you are the parent. So although you may not be the expert in caring for a sick baby in the NICU, you are still the parent and you get to dictate how much involvement you want to be a part of. And this can change over time. You will get frustrated, you will get confused, and that is normal, and that is okay. But you need to feel comfortable asking questions if you don't understand. Ask questions in a respectful way. Make sure you understand what's going on with your baby and what you can do to help. When you're at home or if the nurse and doctor aren't around, make sure you write down any questions or concerns that you might have and ask your nurse. And if she or he can't answer your questions, inquire as to who would be a good person to ask about if there's a certain resource that you can access.
So the second thing to keep in mind is that it's often really useful to keep your baby keep track of all of your baby's medical information. One thing that we were told early on is that creating a binder with all of your child's important medical information inside can be quite helpful and crucial at times. You can ask for the consults and doctor notes to be printed and then keep them in different sections of your binder. This way, all of the information is together and organized, and you can actually bring that binder to any future appointments. And then if you forget something, you can just flip through the pages and look at the information and share that with whoever needs it. If you don't understand something that is written, you can always ask for clarification. A good source would be your nurse. And if he or she doesn't understand what's written as well, then the nurse can direct you to somebody who can help you, or communicate that information to the treating physician.
You know what? That's a really great idea, because a lot of the times I'm a family doctor, so we care for babies after they're discharged from the hospital, and we don't always get all of the information and the tests that are ordered on babies. So if you have that information in a nice binder, you can bring it to your family doctor or your pediatrician, whoever's following up with your baby, and just make sure they have all that information they need to properly care for your baby. So I love that tip. Thank you. The third tip is level of involvement. So like I said before, you're the parent and you get to decide, as long as your baby is safe and stable, what level of involvement and care you want to take with your baby. And that's going to look different for every family. Some families have toddlers at home, so you're divided between the hospital and the home, trying to take care of both of your kids. And some parents, it's their first baby, and so they have a lot of time to spend with that baby. Other people have different social circumstances going on, and they just can't be there all the time, and that is okay. So we know that some babies are very delicate and can't handle much handling. So make sure that you talk to the nurses and physicians about what you can do if you wish to be involved. The level of involvement is going to change over time as your baby matures and grows and gets healthier. So make sure you meet with your nurse every day to talk about your wishes and learn from them what's happening that day, what tests are being ordered, what procedures are being done, and how you can be involved to support your baby through that.
And I just wanted to say one more thing about that, and we will address it in more detail a little bit later. But the concept of needing just some time for yourself, and it's okay if you're not there with your baby all the time, and if you need to just go for a walk or spend time with your partner, or go sleep. That's all fine too. In fact, it's really important. More on that in a bit. But so the fourth point is to call before you go to the hospital if you're trying to make a feed. When you're going to come to the NICU, make sure to call ahead, especially if you're trying to make it for a certain feed. Let your baby's nurse know you're coming, and make sure to show up 15 minutes or even longer before that feed is expected. Babies cannot wait for you to arrive to eat, so plan ahead, and arrive in a timely fashion. And, just let the nurses know what time to expect you, so everybody can be on board.
Speaking about feeding, our fifth tip is breast milk supply and how to optimize that, because having your baby away from you and in the NICU can actually impact your breast milk supply. So a lot of the really good first starts are having lots of skin to skin and lots of latching. And if your baby's unstable and can't do that, or in the NICU, then that can be a real challenge for your breast milk supply. So it's hard to keep up your supply when your baby's in the NICU, but there are some certainly great tips on how to improve this right off the bat. And there's a great website called www.firstdroplets.com, and we'll certainly link to that below. But certainly every woman who's hoping to breastfeed should have a look at that firstdroplets.com website, because it is jam-packed with amazing tips and tricks.
Breastfeeding can certainly be a challenge sometimes, and getting your breast milk in, especially if your baby's in the NICU, it can take some time. So on to tip number 6, which is self-care. So having a baby at the best of times it can be quite stressful, especially if it's your first child and you don't know what to expect, and the roles can be changing with you and your partner, and it can be just a lot can be going on during that time. And then on top of that, if you have a baby in the NICU, that can be very, very stressful and hard on all family members. So, engaging in self care is very, very important, because if you are feeling okay, then that's going to translate to everybody around you feeling calmer and more settled. And it's so important to engage in several steps of self care. One is, just make sure that you're sleeping. You want to get as much rest as possible so that you can have the energy and that you have the motivation and the ability to be present in the NICU. The other thing is making sure that you're eating. Hopefully you could eat something nutritious and healthy, but it's okay sometimes to make a quick stop at the Tim Hortons at Victoria General Hospital, and just make sure that you're eating regular meals, because if your blood sugar drops, you can become irritable and anxious, and that adds to the stress. The other thing is, reaching out to your supports, seeing family, connecting with friends, talking to the social worker, talking to your family doctor or any other medical supports that you might have to talk about what you're going through. It's a very challenging experience. On that note, other parents in the NICU also are a great resource sometimes when appropriate, and you can connect with them. One thing that I often point out to my patients is that people are not only an emotional source of support, but people can be a practical source of support. And what I mean by that is that, for example, parents may want to make meals, meaning your parents may want to make meals for you and your spouse as you're going through the NICU experience. Let them. Gladly accept what they're offering you and say thank you. Laundry or childcare or whatever else that might be. The other couple of things to consider is exercise, or just getting out is important. So go for walks, do whatever form of exercise keeps you healthy. And then engaging in hobbies if you can. Also making sure that you drink plenty of fluids.
Important for the breastfeeding. And those hospitals are often very dry, so the fluids help. So I just wanted to add on a couple of points there. So certainly, it was my second child who was in the NICU, so I had my son at home who was 2 at the time. And so oftentimes my husband and my son would come out and meet me on the lawn of the hospital for lunch. So they'd bring a little picnic and we'd spend a little bit of time together, because otherwise it was really hard to connect. And then oftentimes I would come home in the evening and spend time with my son when my husband went out to see our daughter in the hospital. So it's really important. Part of that self-care is spending time with your loved ones. And for me, that was my husband and son who were in town. We don't have any other family support. So it was kind of the 4 of us at that point. And so we had to kind of negotiate how to do that, but that was really important. I'd also meet friends for lunch at a restaurant nearby, just to get out of the hospital and have some normalcy, because those are really important.
One more thing I wanted to say is, I think right now, especially in these times during COVID, what I've heard from a lot of my patients is that only one parent is allowed in the NICU. So, I oftentimes encouraged people to use technology to stay connected as a family. So you could always FaceTime or take photos. And so then that will kind of, or Skype, or WhatsApp or whatever form of technology you want to use to just be connected.
Yeah, but being very conscious of those around you. So making sure that you are not putting other babies that aren't your own in your view, or other parents. So it is a challenging line to walk in terms of technology in the NICU, because there are so many other people in close proximity. So you don't want to be disturbing other people by talking on Skype during those times, but certainly pictures and videos are great to share with people, and just talk to your nurses about what's appropriate and how you can do it in a way that is respectful to those people around you as well.
Very good point, Alicia. Confidentiality, of your own information, medical information, your baby's information, and those around you as well.
And it's interesting. That's a really tough line to walk in terms of those people around you, and respecting what they're going through as well. Because we really struggled with that, because our daughter was in the highest acuity, so the most intense NICU room for the first couple of days, but she was fine. She was going to be fine. We knew she was going to be fine. But next to us were really premature babies who were struggling for their lives. And so we were in a happy spot. It wasn't quite as we'd planned, but we knew she was going to be fine. And next to us were parents whose babies were literally fighting for their life, and they were having a horribly hard time. And so it was a really challenging thing for my husband and I. This was pre-COVID, so we were both in there at the beginning, to experience that joy of being parents and having a beautiful daughter who needed some support, but we knew would be fine, next to these families who had no idea what was going to happen with their baby. And they were grieving and they were sad, and they were just going through all these emotions. And so we struggled with showing our emotions because we were happy next to them, because we didn't want to interfere in the process that they're going through. So it's a really challenging thing having a little one in the NICU, especially if you know they're going to be fine. They just need some extra support, and you're within close proximity of parents who are really struggling for whatever reason. So just being really conscious of your how you're acting, and being respectful of those around you as well, because you don't know what other people are going through. And that's a really important piece, and a really hard piece about being in the NICU. So our next tip is about asking for help. And Dr. Jasmina kind of talked about that a little bit, but ask for help. When you have a baby in the NICU, you need extra support. When you have a baby, period, you need extra support, but even more so when you have a baby in the NICU. And really be specific. Figure out what would be helpful for you. So having somebody pack some healthy lunches for you and drop them off at the beginning of the week so you can just grab and go and take them to the NICU, or having dinners cooked for you and fill your freezer up, buy groceries, or childcare. Now, when I say be specific, I mean be really specific. So when my daughter was in the NICU, my husband was at home with our son. And so he wanted to come out at a certain time to do a feeding with my daughter. And I wasn't going to be home yet. And so we would ask people to come and care for our son, but they would show up half an hour after we asked, or 45 minutes later, not recognizing the importance of that timeliness. So my husband would miss the feed. And that was really devastating for him sometimes. So if you ask for help, be very specific with what you want. People want to help, but they don't always know how. So if you need them there at a certain time, tell them the time and tell them why you need them at a time. Or for instance, I had to give up dairy because my daughter had really tough reflux. So if we were getting people to help cook, we'd have to be very specific that no dairy in the food, so that it's not making her reflux worse. Now, if I asked that without explaining, they wouldn't get it and they probably would ignore it. But if you give an explanation, you're specific, and you give the reasons why, people are extremely respectful and they just want to help. So that's a really important lesson that we learned the hard way.
Yeah, clear communication is so important during these times, but especially when you're stressed out, and sometimes, just taking a step back to really realize what is it that you need at this point in time, and then slowly and calmly communicating that, kind of the first thing to do. It's hard, but it's really important.
Yeah, and that's kind of mindfulness, right? So what a great place to practice your mindfulness. But in the NICU, when your sweet baby is sleeping, another component of self-care.
The next tip is number 8, is keep an eye on yourself and your partner. Having a baby in the NICU is extremely stressful. The parents can become depressed or anxious or traumatized. It is important to seek help early if you recognize that you or your spouse are struggling. Talk to your doctor or the NICU nurse or social worker. Also, reach out to supports, friends or family, to chat and connect. One way that we got through this difficult situation is that my husband and I had a daily date in the NICU, where this would consist of us going for a walk around the block, or for just one quick meal together, where we were just checking in with each other and making sure that we were on the same page, or if we ever needed to talk about something, privately between one another, make decisions about our child's care or anything at all, we have that opportunity to check in. We also, going back to the clear communication, we also ask for that time, because our families both luckily were around, and they would come in. We would ask them to be with our son while we went and did whatever it is that we needed to do.
And also, you can ask your family doctor for help, or whoever your care provider is during your pregnancy. We're still there to support you postpartum. And so reaching out and asking for help. Normally we would pop into the nursery most days just to check on the parents and the babies and how everybody is doing. So if you're struggling, great time to ask for help. Or everybody should have an on-call doctor or midwife that they can call. So if you're struggling, reach out. We want to hear from you, and we can help to figure out ways to support you while you're going through this. And it's so important that you do. Reaching out for help is a strength, not a weakness. And if we can help support you, then that is also helping to support your baby and your family, which is so important.
And just on that note, if you don't have a family doctor, you can always go to a walk-in clinic and ask for support and help. And just as a psychiatrist, I really encourage the aspect of support, especially when there has been a traumatic event, such as having a child who's having medical difficulties and needs to be in the NICU, because we know that one of the biggest protective factors to prevent development of post-traumatic stress disorder or any sort of trauma-related disorder is support. So definitely utilize that, whether that's professional, whether that's personal support, whether that's practical support, whatever support you need, try to reach out and get that support, because it's so vital for the whole family.
And then our last tip is the exciting time of transitioning home. So generally when your baby is getting close to being discharged within a couple of days, you'll be warned. So make sure you start to really pay attention to the schedules that they're keeping with your baby, because those little babies in the NICU, like it or not, are pretty well trained. They get very patterned in their sleep, wake, and feeding cycles. So certainly if you're kind of keeping an eye on that, you can help to transition them home and keep that regularity up if that's something that you're interested in. We certainly have a top 5 tips for newborn sleep download. I'll link it in the show notes below. It's a free download, and it just kind of helps set the stage for optimizing their sleep as they go through that 4th trimester up to the 12 weeks. But certainly those babies coming out of the NICU, I don't know if you found this as well, but my daughter slept great. She was on a very strict kind of 3-hour schedule and just rotated through that. And as long as we maintained that and we maintained that regularity and didn't let her get over hungry or overtired, she continued that to this day. She still wants to snack every 3 hours, but what can you do? But it was pretty incredible compared to our son, who was a totally different story.
Yeah, Marco certainly was actually quite regimented every 3 hours, and became quite a good sleeper overall. So and I think there is at least some part of that was because of that schedule that was created in the NICU and the regularity. But one other thing I wanted to mention, which I found actually to be a very positive experience of the NICU, is that the nurses were so supportive, and they taught us, literally, this was our first child, and they taught us so many different things. I remember the first bath that we had with my son in the NICU, and he was so little and so fragile, and we were both worried and anxious, like, are we going to drop him? And the nurse was just so wonderful. She walked us through everything. She helped us understand what's the best way to hold him, how to do everything. And so then, when we got home, we felt so much more confident because we've gone through this experience with the nurse. And I can imagine they would have been different had this not happened. So, it was a blessing in disguise.
But it's so important to recognize that, because in life, we have to look for the silver linings. So things don't always go as we planned, and sometimes it's much more challenging than we expect for whatever reason. But if we can start looking for those positive things that are coming out of it, then it changes our perspective on things. And so I think we're going to have a much healthier outcome, especially from a mental health point of view, if we can really look for those positive things, recognizing it's hard, recognizing it's not what you were hoping for, recognizing that it's all way harder than it would have been otherwise potentially, but there's always something positive that you can pull out of it. So for me, the NICU nurses, I agree, were incredible. And to this day, they still ask 6 years later how Evie's doing. And we chat about her, and we can't believe how much time has passed and how much older we are, but we still feel the same, right? And then the sleeping was incredible. And so those are my positive spins on it. Everybody's got their own opinion, but I think it's really important to really kind of look for the positives that are coming out of that situation, because if you always look for the negatives, it's just going to get harder.
Yeah, I absolutely agree. And I also want to add that it's important to recognize the emotions that are coming up and to acknowledge them. Whether it's fear, whether it's sadness, whether it's anger, whether it's guilt, whatever it might be, it's in your best interest, in the best interest of your family, to acknowledge those emotions, to face them and to recognize them. But as best as you can, try not to dwell in those emotions. So this is where especially mindful meditation, is to recognize what is coming up for you, but then learn the skill of shifting your attention and concentration to something else. The one other thing that I wanted to mention is that what I realized as I was sitting in the NICU one day is that, hey, had we lived 100 years ago, 200 years ago, whatever, even 50 years ago, I am not sure in some instances that my child may have survived. And so, I think I felt so grateful in a lot of the moments to know that there are these supports in place. And there are these people here that are working so diligently and so empathically and with such great passion to keep my child well, to keep our family well. And it was that thought that got me through some days, which were tough.
Yeah.
Undoubtedly tough.
If it weren't for my colleagues helping me, I would be dead, as was my daughter. And my husband and my son would be just the two of them. And so you're right. We have to recognize the amazing time we live in, and that we are privileged enough to get the help when we need it and the support when we need it. So reach out, ask for help, ask for support. Take some time to debrief after you're out of the NICU. A couple months later, go talk to a counselor about what you were feeling and debrief it and put it in perspective. That's an amazing thing that I always suggest to my patients. But really, ask for help if you need it. Take the time to recognize the positive things, and enjoy that sweet little baby of yours in whatever way you can, in whatever stability they are, because it's really an important thing to really kind of get those wonderful moments that you still can get, even though it's not really going as you had thought. So thank you so much. Oh, go ahead.
Sorry, I'm going to interrupt you one more time, because you keep on, as you're talking, I'm remembering all of these different things that I think are so key to talk about in this podcast about the NICU experience. I just want to talk about how, these difficult experiences can bring on grief, and grief is a process. And what reminded me of this is your comment about debriefing with a counselor, or going to talk to somebody about this 2 months, 4 months, 6 months, a year, 2 years down the road. Because at least for me and for a lot of people that I've talked to, the grief can come up again at different times. It might not be the same intensity as it was initially when you were in the NICU or shortly after your baby has been discharged home, but it can come up for you at any reminders. And grief is a complex thing. It's not just one emotion. It can come up in different ways. And initially it can present as denial, and then anger, and then bargaining, kind of when you're saying things like, oh, I wish I was in the hospital instead of my baby, and I wish my baby was able to be home with the rest of the family, and versus I could have been here, right? So something along those lines. Then there's also the sadness around that, and then finally acceptance. And these are not stages that come in that sequence necessarily. These are just the stages that you can go through in any which way possible. And so just noticing that this is like a wave, sometimes it will come to you, and at other times, the ocean will be calm. And that's just what it is. And just noticing that, accepting that, and then taking care of yourself, reaching out for supports, and doing all the good stuff that we've talked about.
I feel like this is another podcast in the making. How to cope and debrief from a traumatic birth experience. So maybe we'll get you back for that one. But thank you so much for joining us today. This was a great conversation, and we'll touch base soon.
Thank you so much for having me. I had a lot of fun, and I hope that this has been helpful.
If you enjoyed listening, please head over to iTunes, subscribe so you don't miss any new episodes, and please leave us a review. If you found this helpful, take a screenshot and share on social to help other mamas access this information.
Check out our website at www.shefoundhealth.ca and join our community. We send out weekly emails and release new content focused on this incredible time in your lives. We'll also be sharing exclusive offers, so be sure not to miss out.